everybody.
Welcome back to Safe Space Talk. Join us. Why don't you come in?
Just throw the whole girl. You start. Just throw me in the trash.
Welcome back to Safe Space Talk. Today we're going to be talking about the prenatal care schedule. So this is to hone in on the importance of getting early prenatal care. A lot of people think, there's really not that much going on at the beginning, and they don't come until 25, 30 weeks. But by that time, we've missed valuable time to do education, to get labs. And then on the flip side of this, it shows you how important at the end all of this is, because a lot of this is gathering information to keep you safe in labor. So you do all your prenatal care for that reason. And if you don't have your records and you show up at a place that doesn't have your records at a random place, it makes it very hard for us to treat you. So if you're going to do that, take your records with you. Mm-hmm. I don't care where you want to go. Go wherever you want to go.
Whatever, yeah.
Take your records with you.
I did that.
Yeah. Before we do that, we're going to light our candle. Dun, dun, dun,
dun, dun, dun, dun. As I was lighting it, as I'm sure you guys probably are going to get a wind of that as we were talking about our bloopers, because we're both just hot messes, just trying to make it through life. But since we're all just hot messes, I was over here just lighting up like, let's blaze this sucker. Forgot all about the whole, you. But anyway, so this is for anyone going through tough times, easy times, really crappy times
of your life.
Exactly. Yeah. Celebrating huge things.
We're here for you.
Grieving through big things. We're here for you. So this is us putting that energy out there, letting you know that you are loved, you are valued, you are cared about, and that we want to see you here and we want you back tomorrow. So please hang out and hang in there with us. So we're going to get started today on prenatal schedule.
So, the big misconception, or not misconception, because we kind of lead y'all to believe this, is that the amount of weeks we say that you're pregnant is the amount of weeks you're actually pregnant. So tricks on you, Baha.
I know.
We got you. So you're actually gifted 2 weeks from your menstrual cycle. So if you were actually talking about how many weeks you were pregnant and how old that baby in your womb actually was, it would be 2 weeks less than the amount of weeks pregnant that we're telling you are.
Yeah, because essentially you're pregnant for 40 weeks is what we deem as the, right in between. Average is 38 to 42 weeks. So 40 is what we deem you to be, but give or take those 2 weeks, because those first 2 weeks, it's really the microscopic occurring.
The stuff that's leading up to you getting pregnant. Yeah.
Getting it going.
So with that being said, most people come to us and they're usually around 6 weeks, because this is the time that you're missing your period. You're like, hey, something's going on here. I feel like crap. I feel tired. I feel like I gotta throw up. And then you pee on a stick and congratulations, you're pregnant. Or maybe not congratulations. I don't know your situation.
But you're pregnant. Exactly. You're pregnant. Either way, the test is positive. Right. What are we going to do next?
Yeah. So that's when we get the call. And in my office, and this is what I'm loosely going to base things off of, offices vary. We will bring you in for a urine pregnancy test. That urine pregnancy test says positive. We will draw a beta HCG, which is the hormone, pregnancy hormone that lets us know. And we draw the number for it. So there's the urine pregnancy test that you pee on or have a stick that just shows yes or no. That's just a yes or a no. Are you or are you not? We actually get numbers. So those numbers might not be easy to decipher from people outside the field.
But those numbers are
but they're important.
They're important, but God, they can be misleading.
They can, because it's just it's a snapshot at one moment in time. So in order to get a good accurate picture and trend to see what's going on, you have to get these numbers done every 48 hours if we're concerned about something. So this is if we're concerned about an ectopic pregnancy, if we're concerned about a miscarriage because you've had several and we're kind of on the edge about this. And on top of a beta HCG, we also draw progesterone. So we try to screen the people who may have low progesterones and might be indicating, hey, something might go wrong here. So at that point in time, we supplement with oral or vaginal progesterone up until at least the 12 to 16 week mark. Because if we can do something, why not? So this is 6 weeks. So tiny little baby, and they're like barely got a little heartbeat.
And I think everyone, like whenever I was pregnant at 19, my brain thought I was going to go to my first appointment and get an ultrasound and see a baby. Like I don't know what in my brain told me.
I thought anything.
I literally remember. That's how dumb I was. I was like, I'm gonna
be in there like,
yeah,
hey.
they're gonna show me a little picture and it's gonna be like, oh my god, it's so tiny, like the little flicker and all that little stuff. I just knew it was gonna be a tiny girl, please.
Yeah, usually it's like not even a kernel of rice at
this exactly point in time. But in my mind, I just that was, you're pregnant, you're gonna get an ultrasound, and when you get an ultrasound, you'll be able to see something, and they're gonna point at it, and you're like, oh.
Yeah, nope.
Yeah, that was a very disappointing first visit.
You're like,
I was like,
it looks like a blueberry.
This is
and then from there, based off what numbers we have, we will give you your first dating ultrasound. So if you're not quite at the number that we think you should, we'll bring you back and just every 48 hours keep withdrawing these labs till we think that you should have a heartbeat present, till we think that there should be something visible on an ultrasound. Because at the very beginning, there's nothing visible. So when you're getting mad at your provider because they won't give you an ultrasound, it can cause a lot of confusion. One, because now we don't know what we're seeing. Are we seeing a miscarriage? Are we seeing something that's very early that hasn't started beating yet? We don't know. And this is where mistakes happen, because they'll say, oh, you're miscarrying based on the day you said your period was. So we're going to go ahead and give you some medication to make you go ahead and pass the baby. When if you just wait 2 weeks, that could have been a full-blown baby that just, wasn't where we thought it was yet.
Or your period would have just came and you would have realized that I was never pregnant, I was just off.
Yeah.
And I thought my period was going to come at this time and it didn't. And then you have people that are, gravid 23s and you're like,
yeah, no.
A gravid 23, like, but ma'am, you're 27.
Right. Like, impossible.
You're 27 years old.
Yeah, like, I've seen that where they said they lost a pregnancy.
Yes,
each month.
And it's like,
and you're like, yeah, no.
No, you're going to lose one next month.
Yeah.
It's going to happen again. Yeah. But yeah.
So that'll be around 6 to 8 weeks usually. Okay. And then you come in for your first intake, maybe give like your health history, kind of gather all your medications that you're on, seeing if those are safe to still be taking.
We go over social history.
Yes.
And we also go over,
do you have your resources that you need?
And then any abuse in the household. They also go over family history. That's another big thing.
You have to see like what kind of issues that we may need to be tracking genetically for you and your baby. And then we kind of let you do your thing and grow baby. And then 12 weeks at the end of your first trimester, we do our new OB. So this is a lot of times when you'll get a pap smear if you haven't had one, get a lot of your lab work drawn if you haven't had it done already. So we draw labs to make sure that you're immune to rubella, to varicella. We see what your blood type is. We see if you're anemic starting off or not.
Then they also were checking. They usually do like at least a H&H or a hemoglobin A1C if you're obese. Is really common in some
and PC
facilities.
ratio, thyroid.
Yeah, because the thyroid can be very much affected by pregnancy. Because I know those are things in the blood work that most people don't think about. And then
that go unnoticed by the general public, and those are the things that we hone into, because those are the things that can make or break a pregnancy.
And the difference of like chronic hypertension versus gestational hypertension, the difference of gestational diabetes versus regular diabetes is, did you have this prior to 20 weeks of pregnancy? If you didn't have it prior to 20 weeks of pregnancy, now it's gestational. But if you had it prior to, then you actually are just a type 2 diabetic.
And you may not know if you didn't come in.
Literally, a lot of people, I mean, I can't tell you how many people, they never went to the doctor until they got pregnant. And so this will be the first time that they actually get these labs drawn.
Yeah.
So you'll find out you're diabetic and confirmed pregnancy. You're like, whoa, this is a lot of information to take. But
yes, it happens a lot. It happens a lot, actually. And then this is also where you get a urine culture done. We get a gonorrhea and chlamydia swab on you just to see if there's anything that we need to be treating at the beginning of pregnancy. So these are all the initial labs. And then
other STIs too.
Yeah.
Because obviously we know you've had sex.
Yeah.
And we know you more than likely it was unprotected sex.
Yes.
If you're here.
So syphilis is tested for, HIV is tested for.
Yeah.
And this is when you have the option to do some genetic testing usually. Some of these, so we have 2 pots of genetic testing, and some of these genetic tests can be drawn anytime in your life. It doesn't matter if you're pregnant, not pregnant, but the answer will always stay the same. So these are carrier screenings. These are tests that say, do you carry the cystic fibrosis gene? Do you carry the gene for sickle cell? Do you carry the gene for beta thalassemia? Do you carry the gene for spinal muscular atrophy? Once you know these in your first pregnancy, you never have to be tested for them again. And now you know your status, and if it's negative to all of them, you can't pass them on, and that's the end of it. And your baby cannot have it because you can't pass them on.
Because you have to have both parents have it in order for the child to be diagnosed. So if
you are positive, then we ask you, hey, can you get your baby dad tested and see what their status is, and we'll get you to a geneticist and see what the chances are if your baby having anything. And then you want to talk about the NIPT testing?
Yes. So we there's non-invasive prenatal
I don't know.
testing.
Like,
it really is.
I think it's cool.
No, I think it is the coolest thing in the world. It's like my favorite thing because, like, if you've ever been like me and I'm looking like. Have you ever seen those people doing the gender reveals? And the girl's stomach is like flat. And I'm looking, I'm like, why are y'all shooting at these barrels?
13-week gender reveal.
I'm sitting here like, you're doing a gender reveal, and the girl is like 7 minutes along. You're like, you just posted 2 days ago that you were pregnant. Now here we are at the gender reveal. Like, how did you know?
The fourth time around, I wasn't messing around. I was like, I didn't have these surprise babies on me already. Yeah, let's give it to me. Come on, I need
let me get my mind right. Yeah. So the non-invasive prenatal testing is basically a blood test. So we literally go in just like any other lab draw, and we draw that. And from there, they can actually decipher from maternal blood. They can actually get cells from baby's blood that's circulating around with it. And they can actually do like a karyotype. So they actually look to see what genes are there, if there's any deletions, anything abnormal about the genes in the infant that will be. And they can do it. They can do their sexual testing as well. So you'll know if your baby's going to be born with male parts or if your baby's going to be born with female parts. And so they can give that to you as early as 10 weeks. But typically we're doing it at least 12 weeks in just to get the best reading.
Yes, because also if you're obese, you have a less likely chance of
being correct. Yeah. Mm-hmm. And so, and I always, I try.
But once you do have a good fetal cell fraction, it is very accurate. So people are like, should I wait on the ultrasound?
Ultrasound, no. Nope, do not. The ultrasound is less, like, this is the most accurate you're going to get as far as knowing the sex of the baby.
If you want to dress your baby with a penis in blue, this is what you have to listen to.
Exactly. Because the ultrasound can be
baby
off.
With a vagina in pink, this is what you have to listen to.
Or you'll have a baby with an ultrasound like this. And this is them. It's Prince. Like, paint me like one of you French girls.
Prince.
It's like this. And this is your baby the whole time, and they're just hiding it. So this is going to be, like, we promise you this is what you're having. So the biggest thing I like to tell people, if you do not want to know the sex of your baby, this is not the test for you to open. This is the test for you to get someone that you trust to open and read the important things. That way, whenever you go to look at your chart, you don't accidentally get that surprise.
Or you have to wait until your provider, and then tell your provider that you don't want to know.
That you don't want to know.
Review the genetics with you.
Exactly. So you can get that done. These are all things that you can refuse these. And then, so we have that one. That one is as early as 10 weeks. But like we said, people that suffer with obesity and things like that, you're going to be pushed further back. So it's easier to just make it a blanketed 12 to 13 weeks that you can do it. And then there's testing that you can do that is called integrated and sequential. So we've got the ones that we can draw it at the first, almost at the first visit, I feel like, and then it's the 13th week or something like that.
And it's like it's 2 scores that you add together.
So they take one early in the pregnancy, and then they'll take one in the second trimester of the pregnancy. And that one goes over things more like Down syndrome, and then the other trisomies. So those you will get an answer on later, but they're very definitive when you do get those answers. So these are going to be more so the non-invasive prenatal screening that I talked about, or the non-invasive prenatal testing, NIPS, NIT, whatever you want to call it. Those can be done by the blood draw, and they can be done at the 12-week mark, and it'll give you the karyotype. It'll give you the genes, but the alpha theta protein is only
the protein.
It's only with that sequential and that integrated screen.
So at my clinic, we don't offer that. We only do the AFPs at 16 weeks. So 16 to 20-ish weeks, you'll be offered what's called either quad screen or AFP to test.
I don't think anybody's doing pentascreens. Too much money
to do the to see for alpha fetal protein, and that will alert you not as high of a specificity, and it's not as good because it's an older test, but it still will give you clues into spina bifida and having any kind of like spinal cord disorders or issues
and things like that.
Yeah, so it's a good test, but it is from 16 to 20 weeks. So if you're coming into your prenatal care after 20 weeks, you've missed it. And then usually from around 20 weeks, you get your anatomy scan. Yeah. So if you want to talk about that.
So that'll be an ultrasound that they do between 19 to 21 weeks usually. And that's where they go in and they look at the 4 chambers of. So everyone knows this is their baby picture. You know, this is whenever you get to see the whole baby. This is whenever they find out the sex of the baby. Usually, like as old as I am, that was way back in the day. That was when you found out the sex of the baby. It was at your anatomy scan that the baby showed you. But they're actually looking at really important things. They're looking at the chambers of the heart. They're making sure there's 4 of them. They're making sure that everything that the baby needs to have in the brain, that all of it is there, that there's not portions of the brain that are missing. They're trying to look at the spine and look at the spinal cord and make sure that there's no opening and things like that. So the things that we're not even thinking about, we're just thinking about our beautiful baby and all that stuff that we're seeing by default. They're actually looking. Are there 2 lungs there? Does it look like the lungs are doing their practice breathing? Because it's almost like a BPP in it, within it. Because your babies are not. I always feel bad because they're like, but how's the baby breathing in there? I'm like, your baby is not breathing in there, but they do practice breathing movements. So you'll see the lungs literally like doing like this, like spasming, the same way yours would spasm if you were holding your breath underwater for a long time. Like the muscles are still doing contractions, but they're not actually exchanging air. So they can do that at the same time, and then that's pretty much it. They look for all the 5 fingers, all the 5 toes, all of the things get a weight, a measurement. Yeah. And they do the femur length. Yeah. They do the head length, or the head diameter. And they're basically looking on this spectrum of 0 to 100. Where does your baby fall as far as everyone else's baby at this age, at this time? Is your baby much bigger? Is your baby about the same? And this test, which is like an estimated fetal weight, is going to change dramatically after this 19 to 21 week test. So this is not the time to say, oh, my due date is, or my due date is different, because the ultrasound said that, it said I was due May 1st, but the ultrasound says that I'm due, May 12th. No. Whatever we said was your due date is your due date. Don't go by the due date that pops up, because you have to remember it's every single human that's ever been born in history. All of their numbers are in these numbers. So the 6'9" and the 6'7" basketball couple that had a baby, their numbers are added in there too. So it's literally along that whole spectrum of every human. What were their numbers? And they're comparing your numbers to that number. So your baby is not going to be the same size. So therefore it's going to come up with a date that's going to seem different than what we gave you, but don't change that date.
It's not changing.
It's not.
And then you 24 weeks is, I would say, I call it the boring visit. We review things, but I always say that this is a special time in pregnancy because you've hit your viability mark. Yes. So I always tell them, go get something to eat, have a little celebration. Viability is the point at which that medical science has evolved to the point that we can take this baby and possibly keep it alive outside of the womb, which was not done prior to. Some bigger facilities go down 22 to 23 weeks, but 24 weeks has been kind of the standard. For what we say is now viable. Doesn't mean that the baby will survive. However, there is a chance that it could.
Exactly. I think it's 50-50 at like 20.
Oh yeah, the chances aren't great.
Like 70 at 27 or something.
So keep your baby in there. Exactly. That's why you don't need to have your baby early.
Exactly.
And then you hit 28 weeks. So 28 weeks is the next big visit. This is the beginning of your 3rd trimester. So this is when we're testing you for gestational diabetes. You come in, you drink that sweet drink. You wait an hour. They take your blood. When they take your blood, they're testing you for syphilis, which is mandated in the state of North Carolina. It has to be tested at the beginning of the 3rd trimester. And they're also testing a CBC, which will tell us if you are anemic or not.
And then for those that are not, most are. But for those that are not in North Carolina, I think most places are still, like, they'll still do a syphilis test
at the beginning,
sometime in that 3rd trimester, because syphilis is so treatable. And to not treat it in pregnancy is just cruel.
And honestly, we have a lot of young girls with syphilis that are pregnant. It's pretty sad.
It's crazy. It's like I guess it's not a pandemic, but anyways, it's out there more than you think it's out there.
Yes. And then you're going to come back at your 32 weeks.
Well, don't forget Tdap.
Oh yeah, and then we offer you your
We're gonna give
Tdap.
you.
Yeah, so we offer you
Chase you down with the
your
Tdap shot.
Tdap shot, which is the tetanus, diphtheria, and pertussis. Pertussis is what we are really concerned about because babies cannot get that shot the first couple months of life. Mm-hmm. So we want to give it to you so it can go through your placenta and get to the baby and give that cocoon of protection. And it also serves the purpose that if you have not had it, which most people have, but if you have not had that shot in the past 10 years, that you're also not getting that. You should also probably tell people around you that are going to be taking care of the baby.
Make sure that they
to
have
get
it.
that shot. Mm-hmm.
And
if you are Rh negative, you're also going to get your RhoGAM shot at this point in time. So RhoGAM helps. We need to do a whole episode on that. Probably.
Yeah, that would be basically if it's negative blood type, in the chance that your baby is a positive blood type. So it's not for this pregnancy, but for the pregnancies. It's not for the first pregnancy, but it's for the pregnancies afterwards. And even if you're saying, I don't care, I will never have another baby, I want my tubes tied afterwards, honey, you still bend over.
Like, get your RhoGAM.
You're still getting the RhoGAM shot. That's when it's really going to be.
So then you have your 32-week visit.
Which is when they first put you on the monitor, right?
No, not really. For us, if you have any kind of risk factors, yeah. And then at 36 weeks, which is, every 4 weeks you're having your visits up until, till 28 weeks. And then, when you hit 28 weeks, it's every 2 weeks that you visit. So then you're at, 28-week visit, 30-week visit, 32-week visit, 34, and then you're at 36. So now at 36, we're doing
GBS. You got to get your GBS. And then if they didn't do your STD screenings, the GBS is going to be a test that's going to take a few days to come back. And then, let's see here, we got that. And then, from my understanding, we usually would put them on the monitor.
So, yeah, we didn't, but they may at some places. So you guys just ran NSTs on everybody? Yeah, so is that to keep people out of triage?
Yeah, I guess part of it to keep out of triage, but to also verify that everything looked good with baby without having to use ultrasound.
Oh, that's interesting.
Because it was cheaper for them.
We would do it. We would, like, if you have a teen pregnancy or any kind of risk factors.
I guess that's because the clinic was everybody was. Basically, everybody was.
Okay, so everybody had some risk factors.
Just about high risk.
Okay,
basically.
Yeah, so then that makes sense. You're getting your antenatal testing. Yeah, so like if you develop risk factors as your pregnancy goes on, you start to get more fetal surveillance, which could be the NST test, could be ultrasound.
Even if you're older, if you're obese, things like that. There's all these. Extra risks, so they would just get a tracing on you, make sure that baby looked great.
Look at baby's heart rate over the period of at least 20
minutes. And they would usually do that before we'd even go in and see the patient.
I do my visit while they're on the NST because I try to get people through
to do it simultaneously, so you get everything done. But yeah, and
so that I'm watching it because a lot of people who put the ladies on the monitor don't know how to read or strip, so they could be like monitoring the mom the whole time. Yeah, and I'm walking in later, so it's like I like to come and just watch it as I'm talking to them. So
a lot of times I call it the gotcha appointment.
Gotcha.
Yes, because if you do put them on the monitor, let's say they put you on the monitor just to make sure everything's looking copacetic, and it just doesn't look exactly how we want it to look. You just knew you were leaving and go and get lunch afterwards, and then
you
need to go to the triage unit and have everybody get you checked out.
So your GBS swabs,
your GBS swab, urine culture,
which some people allow you to collect yourself. I allow some people to self-collect if they're comfortable with it. It's going to be a swab that goes on the outside of your vagina and then up your butt crack like you're wiping your butt. It has to come across your butthole. I always tell it has to, just like you wiping your butt and you want it to get clean with it. If you're trying to wipe your butt with a little Q-tip,
this is how you would wipe it. And they send that down, and those are the biggest things. I know usually if they ask for STI testing,
we give it to everybody at 36
at 36 So STI,
and then we
GBS.
Also do drug screens on everybody at 36 weeks. And this is not to be mean, y'all, but this is so we know who to have on our pediatricians at the birth if there's any opioids or if there's any kind of more hardcore drugs, because everybody's THC positive.
I feel like everybody, like I just read it and I'm like,
yep, I know. Next.
Next.
All right, cool. But we need to know which babies that we need to be putting on morphine withdrawal, like precautions, and so that's what that's for. A lot of people think, I guess, you're trying to be sneaky, which I'm not. At the beginning of at the pregnancy and at the end, we test everybody at my clinic. So there's no sneakiness involved. You know exactly when it's happening. And so then after that, when you hit 36 weeks, every week you'll have a visit, because this is when things are most likely to develop in your pregnancy. This is when your blood pressure is going to go crazy. You're going to develop preeclampsia. all of a sudden your baby's growth is going to go off the charts, either big or small. You get your all of a sudden now itching because you have ICP or whatever the issue may be.
They start to
this is
pronounce
when
themselves.
This is when they come out. So then every week at your visit, depending on if you need more testing, you'll have that. And if not, then we just kind of wait and watch you get miserable until it's time. And then usually we start looking for an induction date. I usually at your due date or the week that is your due date. When you come to see me, then we'll start talking about induction.
Yeah, if you're not already having the contractions and things like that. This is going to be usually whenever they start complaining about, I'm miserable, I'm having hemorrhoids, I just want this
tired,
to be done.
I can't sleep.
Yes, we call it tired of toting.
Tired of toting. I want to be out of work. I want to, all the things.
Can I get a work note for these things? And I beg of you, like, it sounds so cruel, but can I get induced? I'm really ready for this baby to be out.
If you're telling me that at 36 weeks, I'm gonna still look at you at 39 weeks.
No, like I'm so sorry. Like, I hate to say it, but ma'am, like, you kind of have to be in it to win it, and that's all I can say.
Not if you cry to the right provider. There's some providers at my place that will be like, I have pity on you, and then send them over for me to induce. Yeah,
and then whenever it doesn't work out, they're like, well, I mean, what can you say? She was only 37 weeks. I know, you scheduled her. Like, we trust me.
As she's rolling out the OR, it didn't work. I wonder why.
You're 37 weeks with no prostaglandin, ready to rock and roll. But so you'll ask us all of those questions, and then so it'll be the misery of the pregnancy. Like, not saying that every pregnant person will be miserable, but the ones that are, they're really begging for all the things at this point. And then, that's when you'll ask us, how do you induce, how can I get this baby out on my own and all that stuff.
Your membranes, maybe teach you some natural labor prep. But we'll have some other episodes digging into that. But that is pretty much the overview of the prenatal care schedule. So
and very early we decide where you're going to be delivering, because some places they have a few hospitals. So make sure that you know where you're going to be delivering.
That's
if you're
something that comes up all too common too late.
Yes,
they'll find out
like, can I have a doula at the hospital? Like, oh, honey.
Or they'll ask me like, well, when I go to Chapel Hill, will you be there? And I'm like, no, I don't work there.
Yeah. And then if you've had a C-section before, things like that, you need to know, because certain facilities will not let you have a vaginal birth after a C-section. It does not matter how healthy you are, and it could have been because the baby was breech. Literally, you did nothing wrong. You just were breathing and blinking and you had a C-section. Nope, we just don't do VBACs here. Sorry. And that's something you don't want to find out at your, 37 week visit. Yeah. And it's like, now I have to travel to a neighboring, facility or what have you, and they don't have my records. So all of those things. But so the short answer is, how often will I be seen during my pregnancy? You'll be seen to confirm the pregnancy. You'll be seen every 4 weeks up until the 28-week mark. At the 28-week mark, you'll be seen every 2 weeks until you get to the 36-week mark. And then when you get to the 36-week mark, we will see you every week until baby is delivered and out.
And then we, at my clinic, have a 1 week postpartum visit. And then a 6 week postpartum visit.
Oh, for everyone. Okay, so where I was at, they did 1 week for like elevated blood pressure.
Yeah, and I think that's what most people do. But I have actually a good collaborative provider, and he's young. He doesn't have kids, but I won't hold it against him.
Well, if he's making that kind of decision, I'm all for it.
Yeah, no, that was something he actually spearheaded. So yeah,
I love that. Yeah. I love that, because I feel like 1 week is about that time where I call it the mommy. Yeah, I call it the mommy cliff. I was literally ready to throw myself against the wall. Like that 7 to 9 days, I don't know what it is, but that 7 to 9 days, you're like,
because the sleep is minimal.
And the 11th day, you're just crazy at that point. Well, I let me rephrase it. The 11th day, I was crazy, and that was just me. So I'm all for the 1 week appointments.
I was too. Yeah,
it's like the 11th day did it. Like,
yeah, because that's when they're crying and they're like, "I'm fine," and you're like,
are you though? And then the 6 week, and so the 6 weeks. So now, do you all do checks like vaginal exams?
Unless they're requesting it or they needed a PAP.
But I've had where others, they're like, nope, we don't take your pants off, don't do nothing.
Yeah,
and I'm like, oh, okay.
Yeah, unless you have a request.
Unless you have a reason, we're not going down there.
But that was the prenatal care schedule overview, guys. I hope you enjoyed this episode, and we will see you next week. Bye.
Oh, and we'll blow out our little candle. Yeah. But I don't see if I can get it over here fast enough. All right, everybody. There we go. Thank you.
Bye. Damn, got the body.
I think they probably get more from our bloopers than they probably get from the whole dog.
Yeah, I said I was gonna start making bloopers too.
Yes, like at this point, because we're such a hot mess. Oh shit.